So now we're going to do just a short role play, just demonstrating an example of a GP trying to sort of convince or encourage one of their patients to sort of stop smoking. So yeah. Hi Francis, my name is Robin. I'm the GP today. So how can I help you?
Well, I've just been feeling really stressed and just really down lately, and I've just been smoking a lot, and I'm really kind of struggling with it because it's something that's been going on for a long time, and it's started to kind of escalate now. So I came for just a bit of advice.
Yeah. Okay, so you said that you've started smoking a lot. How many cigarettes or how many packets a day do you think you're smoking on average?
Probably about 60, I'd say.
60.
On a typical day.
Okay.
So,
right.
Yeah.
All right. So how long has this been going on for? So you said it's been going on for quite a while. Do you have a rough idea of months, years?
Years. I think it's probably been going on for about 7-8 years now.
Okay.
I started off as like a teenager. It was kind of like social
Yeah.
smoking kind of thing, and now it's just been getting a lot worse. So yeah.
All right. So has anything recently changed that's sort of made you increase your smoking, or you said you're a bit stressed, so sort of has anything triggered that?
Yeah. Well, it's just been a bit hard recently because one of my family members passed away.
I'm sorry to hear that.
Yeah, and it's just the whole idea of being able to manage that and trying to adapt to the situation has been very difficult for me. So I think that could have potentially triggered it. But,
have you been receiving any help for bereavement at
all? I mean, I've got like quite a few supportive friends, and also a few other family members as well. Who have been supporting me through this as well.
Yeah.
So yeah, it is getting better, kind of coping with that. But then at the same time, the smoking thing is kind of making things worse. So
it's kind of a double-edged sword, really.
Yeah.
Okay. I mean, from my end, I can sort of maybe sort out some sort of bereavement counselling. If maybe you'd like to look into that, that could, it might help towards the sort of bereavement side of things, which might then help the smoking a bit. I mean, if you're sort of wanting to think about that or need to set up a referral for that, I'm more than happy to do so.
Yeah, I mean, that would be an option. Is there anything that you could do in terms of providing support to help me stop smoking specifically?
Yeah. Well, for the smoking specifically, obviously you need willpower.
Yeah.
So if you feel that you're in the right frame of mind to stop smoking, I mean, obviously you've come to me today, so you must have some, sort of determination to sort of stop. So from my end, we've got a smoking cessation nurse within practice. She's able to sort of talk to you about your habits, and we can get you sort of started on maybe some nicotine patches. So obviously you're aware of the implications of smoking. Not really?
Not really, no.
Okay, no, that's fine. So basically the issue with smoking, it obviously irritates, the tubes which go into your lungs and help you breathe. It can also damage the lungs themselves. So, about issues like lung cancer. Does anyone in your family smoke? Or?
My dad smoked for quite a while, yeah. My mum doesn't smoke.
Your mum doesn't smoke, okay. How's your dad? Is he, or... How is your dad? Is he okay?
I'm not too sure at the moment. He died quite a while ago, so yeah. I'm not sure what he died of. It could have potentially been the lung cancer that you were talking about, but I don't know a lot about it. Yeah.
So basically, lung cancer, it's sort of the most detrimental side effect from smoking. Not to scare you, but it, sort of 9 out of 10 cases are caused by smoking. But I mean, it's just obviously because of the irritation given by the smoke, and it's toxic and it can cause lots of nasty problems. There's also a thing called COPD. So this is chronic obstructive pulmonary disorder. So not to flag you down with words, but this is basically where the tubes bringing the air into your lungs get irreversibly narrowed. So that means not a lot of air can come in and out, and you can get quite wheezy, quite out of breath, and you can get quite a lot of infections because of that. So there's just a lot of issues that can arise from smoking, and again, it can make you out of breath, tired. It's also quite an expensive habit, if you probably noticed. So that's probably one thing that you'll find quite quickly. You know, you'll have a bit more money here and there, and you know, maybe again, as an incentive to stop smoking, you could use that to sort of buy something nice, or you know. So there's a smoking cessation nurse, as I mentioned earlier. So she'll be able to give you start you on maybe nicotine patches, look at other alternatives. Have you tried sort of e-cigarettes at all?
I have tried them,
but not.
No, it doesn't really do it for me.
Yeah. Okay. So we'll get you an appointment with the nurse if you're happy with that. What do you think?
Right. Okay. Yeah. I'm happy with
that. So we'll sit you down with her, and she'll have a chat with you about getting either patches sorted or anything that will work for you. We'll talk about your habits. I'll be able to sort of get that referral sorted to the bereavement counsellor if that's what you're wanting. Is there anything else that I can do for you today?
No.
Any other questions that you'd like to ask?
That's all I came for.
Okay, that's fine.
Much.
No problem.
Thanks.
Okay, so in that scenario, the main thing was sort of introducing yourself and sort of asking how the patient's doing, asking the patient's name and things. And again, it's important to ask about why they're here, what their recent health is. As Francis mentioned in the consultation, him being quite stressed, and then mentioning the smoking. So it's good to pick up on associations like that, because the person, again, that yes, they might smoke, but the stress might have increased their smoking habits. The stress might have caused the smoking in the first place. So it's just good to look at other alternatives as to what might have caused the issue. So again, it's just talking that through with the patient, and then again, I was trying my best to display active listening skills. So sort of nodding, really trying to engage with Francis on what he was saying, and being able to show that I was listening and understanding. So again, using sort of like open questions. So for example, I was saying, oh, so you said you're stressed. So again, tell me a bit more about that. So it's just good to have that idea, to keep it open and not to direct questions with a yes or no answer, because that keeps the consultation quite rigid and quite, you know, you want the consultation to be open and patients to feel comfortable discussing with you. So again, it's also important to check that the patient understands what you're saying to them. So in that consultation, I maybe tried to jump in a bit too quickly and then decide to check whether the patient understood. But I think what you're best doing is approaching it, asking the patient if they understand any, you know, medical jargon, do they understand the risks and implications, and then if not, then go on to discuss that with them, because it just, again, maximises their understanding and removes sort of barriers that are put in the way, which can prevent a patient from really understanding information and taking it home. And again, as I mentioned before, it's picking up on other sort of problems that arise in the consultation. So again, the primary issue was the smoking, and that was addressed. But again, the stress from bereavement, it's nice to be able to pick up on that and to be able to put something in place for that as other alternatives to try and reduce the main issue, which is the smoking. And do you have any?
No, I think that's pretty well explained.
Yeah. And again, just providing information and rounding the consultation off nicely, asking if the patient has any questions, sort of any concerns or any other problems, which always makes for a good consultation. So relating back to that scenario before, it's always really important to have in the back of your mind sort of consultation skills and things which really make a consultation and taking history stand out. So as I said, it's not just what you say, it's also your communication skills and how you come across within that scenario. So sort of the prime position for taking a consultation would probably be where you're both sat down but not facing each other eye to eye, because that can become a bit confrontational. So it's often quite good to have the chairs at an angle, sort of sitting by the patient, you know, having it open but, you know, not directly facing each other, because again you don't want it to be confrontational, and again you want enough distance between you both for it not to be too suffocating but not too distant and not too apart. So again, as I said earlier, having open questions with the patient. So there's a thing, and it's expressing ideas, concerns and expectations. So this is a quite good structure to have within a consultation. So sort of ideas that the patient might have, so why they're there, you know, what they want sorting, sort of concerns that the patient has, why have they come today, you know, why are they worried, and expectations, sort of what is it that they want out of the consultation, and what can you give to them to sort of benefit things. So those are some key points which are really good at being able to maximise the consultation and get as much as you can out of it. So again, at the end, it's always really nice to round it off just to summarise what you've talked about. Like I said earlier, I sort of summarise, say, okay, we're going to get you sent to the smoking cessation nurse to try and reduce your smoking habits, and referral to bereavement counselling. So again, addressing the two main issues that were presented at the start of the consultation.